Good morning. Thank you for coming. Is this on? Hello? Hello. Thank you for coming. My name is Gary Smith. And in addition to the titles that Sherry mentioned to you, my clinical background is as a pediatric emergency medicine physician. And I've worked at large pediatric hospital emergency departments, trauma centers across the country. And I've treated innumerable children for injuries, including injuries due to consumer fireworks. And that's what I'm here today to talk to you about. You know, when we see these kids coming in, they're always around the 4th of July. It's always just such a tragic thing to see because many of these injuries are very serious. The most serious ones we see are typically the eye injuries and then also the kids that have serious burns. The most serious burns often occur when the clothes catch on fire because they just can't get those off in time. And these kids can have very debilitating lifelong scarring and disability from those burns. And so it's something that when we see that, we just, you know, this can be avoided. Can we do something about it? And so we got active. I got active in this a number of years ago. The American Academy of Pediatrics was very interested in coming out with a statement. So I was the lead author of their policy statement on firework-related injuries. And then I was the representative with the National Fire Protection Association when the American Academy of Pediatrics and the NFPA got together and formed the coalition, the Alliance Against Consumer Fireworks. And that group now has grown to over 20. Should I wait?
Yeah. See you Wednesday.
Wednesday test.
Good video. They had scheduled our question and answer for 12 minutes.
Thank you. So I was saying the American Academy of Pediatrics and the National Fire Protection Association joined forces, created this alliance against consumer fireworks, and that group now has grown to over 20 national medical, public health, and fire organizations. And they every year have press conferences and send out information calling for the ban on the use of backyard or consumer fireworks. So we've been very active in this for a long time. I also got involved as a researcher. I do a lot of research on pediatric injury. Okay, so Marshall Flower says that's usually it, so we'll give it a shot here. So the work we've done in the area of research, we did a national study published back in 2006. We had 85,000 children injured across this country due to consumer fireworks. These were kids under the age of 18 over about a 14-year period. And what we found was very interesting. One of the most important findings was that in that study, 25% of the kids were bystanders. Now, the 50% that Sherry mentioned comes from a study back in '95 using the National Eye Injury Registry, which is very severe eye injuries. And in that registry, about half of eye injuries are due to fireworks, primarily the bottle rocket. I said that wrong. Half of the injuries are to bystanders, and that's primarily to the bottle rocket. And because that's by definition, if you ever seen a bottle rocket take off, it's out of control the moment it's launched. And so bystanders are often the people that get struck. And the eye, unfortunately, is one of the very severe injuries that we commonly see with that firework. So 25% of the children in that study that we did back in 2006 were bystanders. And what that tells us is that child simply being in the area when a firework is being used puts them at serious risk for injury. And it dispels the myth that adults or parents can launch or light fireworks with children just simply observing, because the children are still going to be at risk. So the message is that under those conditions, the children are simply not safe. Another study we did back previous to that, in 1996, looked at the experience of one emergency department. That was over a 17-year period in Kansas City. Over 300 children were treated. And in that series, the injuries were quite severe. About 11% of those children required hospitalization. 5% went to the operating room. There was one death. And many, over 5%, had long-term disability, including 2% that had vision loss. So in that study, remarkably serious injuries were occurring. And the thing that we found there as well is that 26% of those children were bystanders. So an important message to parents is you can't launch or light fireworks and have children standing by and expect them to be safe. Another important finding from that study in Kansas City was that over half of the children were being supervised at the time that they were using the firework. And I can tell you, as an emergency medicine physician, I hear the same words every time when the child is brought in by their parents. Doctor, I was standing right there. It happened so quickly, there was no time to react. And I'm going to tell you, want to assure you, these are good parents. They care about their kids. They weren't misusing the firework. They had simply bought the myth that these products can be used safely. And so the take-home message is that supervision is not enough. There are no conditions, under no conditions are backyard fireworks safe to use. And so I just want to leave that message with parents today. Please spend your holiday enjoying the holiday at a public display with your family. Don't spend it down in the emergency department. Thank you.